Suki Bass Motors is BC's most trusted independent auto dealership. We currently have over 400 vehicles in inventory.
Our sales team can help you find the right vehicle within your budget. Take advantage of several promotions such as 0 down payment, 0 interest, and 0 payments for up to 9 months.
Suki Bass Motors has a fully certified service center. We can repair all types of vehicles.
At Suki Bass Motors, all types of credit is approved for an auto loan. We are proudly partnered with Greenlight Financing and Quick Finance Corporation. Please visit us at SukiBassMotors.com.
सत श्री अकाल जी चढ़दीकला टाइम टीवी वेख रहे सारे दर्शकों का स्वागत है। नॉर्थ अमेरिका न्यूज़ दे विच मैं हां तुहाडे नाल मनदीप कौर खालसा ते शुरुआत विच एक नज़र मार लेने हैं खास खबरां ते। कैनेडा के प्रधानमंत्री जस्टिन ट्रूडो ते ओंटारियो के प्रीमियर डग फोर्ड ने की सांझी प्रेस कानफ्रेंस गोल्ड माइनिंग प्रोजेक्ट लई फैडरल सरकार की रणनीति बारे दी जानकारी। फैडरल सेहत मंत्री पैटी हसदू ने कैनेडा सरकार के भलाई कारजां बारे दी जानकारी। कहा कैनेडा वासियों की सेहत नूं लैके सरकार ने बेहद गंभीरता नाल कीता काम। आरसीएमपी ने साबका लिबरल एमपी राज गरेवाल नूं विश्वास तोड़न के 4 मामलों ते $5000 तो वध दे फराड के मामले विच कीता चार्ज। साबका कैबिनेट मंत्री ते एमएलए जिन्नी सिम्स नूं BC NTP वालों सरी पैनोरामा हल्के तो मुड़ किया गया नामजद। ते हुण खबरां विस्तार नाल। कैनेडा के प्रधानमंत्री जस्टिन ट्रूडो ते ओंटारियो के प्रीमियर डग फोर्ड ने गोल्ड माइनिंग प्रोजेक्ट ते सांझी प्रेस कानफ्रेंस की जिस विच ट्रूडो ने वी चैरिटी वालों कैनेडा विच अपना कामकार बंद करने बारे चानना पाया। उन्होंने दस्सिया कि वी चैरिटी ने फैडरल सरकार दे नाल सारे समझौते रद्द कर दिते ने। इस दे नाल ही विद्यार्थी ग्रांट प्रोग्राम का प्रबंधन किया गया सी। गोल्ड माइनिंग प्रोजेक्ट लई भी उन्होंने फैडरल सरकार की अपनी रणनीति बारे दस्सिया।
As of January 2nd, Dr. Tam convened a meeting of her counterparts across the provinces to talk about the concern around this potential virus infection. Throughout the month of January, we had meetings, including incident response group meetings, where we looked at the concerns we had and talked about our preparation, and that continued. Every step of the way we were informed by our experts as to how to keep Canadians safe, what needed to be done, what measures would be helpful in continuing to support Canadians as we were aware of this potential. But as people know, we were very much learning on the way as we responded. The commitment we made to Canadians that we would be there for them, we would put their safety first, and that's what we've done every step of the way. Canadians pulled together over these past months and managed to flatten the curve. And we're seeing reopening in the economy. We're seeing investments coming back in. But we need to keep vigilant. We need to continue to be very careful. We need to be continuing to wear our masks, continuing to keep our distances, and make sure that we do not see a spike in a second wave that we know would be deadly for Canadians and perhaps cause us to have to go back to the unpleasant places we were in the spring where we were all in lockdown. So as we continue to learn more about this virus, as we continue to do everything we can to keep safe, I just want to continue to remind Canadians to continue listening to public health recommendations and keep each other safe. En sécurité. We were very pleased to be able to demonstrate the level of collaboration, partnership and cooperation between all orders of government across this country. Being able to come together with a $19 billion agreement for a safe restart of our economy, to be able to step up with $2 billion more on specifically safe schools reopening so that our kids can be extra protected as they start school again. These were things that are important to all Canadians and something I was very, very pleased to work with the premiers on, particularly Premier Ford, who was very strong on both of those measures as we moved forward. We have worked out the agreements in details now, and the money should be flowing within the coming weeks. This federal government is very much focused on investing in the mining sector and creating good jobs for communities right across the country. It's important that we do it with an eye towards the future, which means sustainability, which also means partnership with Indigenous communities. And the way I Am Gold has worked with local Indigenous communities is a model that we certainly would see in many places across the country, would like to see in more places across the country.
ਮਾਈਨਿੰਗ ਪ੍ਰੋਗਰਾਮ ਪ੍ਰੋਜੈਕਟ ਦੇ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦੇ ਹੋਏ ਪ੍ਰੀਮੀਅਰ ਡੈਗਫੋਰਡ ਨੇ ਕਿਹਾ ਕਿ ਕੁਦਰਤੀ ਸਰੋਤਾਂ ਲਈ ਫੈਡਰਲ ਅਤੇ ਸੂਬਾ ਸਰਕਾਰ ਮਿਲ ਕੇ ਕੰਮ ਕਰਨ ਜਾ ਰਹੇ ਨੇ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਕੋਰੋਨਾ ਵਾਇਰਸ ਮਹਾਮਾਰੀ ਦੌਰਾਨ ਬੈਕ ਟੂ ਸਕੂਲ ਪਲਾਨ ਬਾਰੇ ਵੀ ਚਰਚਾ ਕੀਤੀ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਇਸ ਮਸਲੇ ਤੇ ਫਾਈਨਾਂਸ ਅਤੇ ਸਿੱਖਿਆ ਮੰਤਰੀ ਦੇ ਸਲਾਹ ਮਸ਼ਵਰੇ ਨਾਲ ਮਿਲ ਕੇ ਹੀ ਕੰਮ ਕਰ ਰਹੇ ਹਾਂ।
Well, Minister Rickford, I always say he's an all-star up here. He works extremely well with the Indigenous community, also the Minister of Mining and Forestry and Development. And he has a strong plan moving forward to have resources shared amongst Indigenous communities. Is so important, because without the Indigenous community support, no matter where we are, this just doesn't happen. So again, just like the Prime Minister said, when everyone works collaboratively together, it's a win-win-win for everyone across the board. Well, we're always there to support the people, no matter if it's parents that have to stay at home. And I've always said we're going to be transparent. It's online right now, so it's up and running. But not only for schools, but for childcare as well. And we'll do whatever it takes to support parents. It's not their fault that they have to stay at home and take care of a sick child. So we'll be there and support them, and we'll be working with our Minister of Finance and other ministries to make sure, Minister of Education, to make sure that they're supported. We're always open to the possibility of supporting families that are in need, as the federal government has shown, as the provincial government. We've spent over $30 billion supporting companies and people right across this province, and we're grateful once again for the support the federal government has shown supporting ourselves, especially in municipalities and transit. A wide range of different items when they came to the table with a massive package, and we're grateful for that. So we're always open to making sure that we support the people, keep them back on their feet, and we'll get over this, and everyone will prosper and grow. First of all, I couldn't ask for a better Minister of Francophone Affairs than Caroline Mulroney. She has done so much work for the Francophone community here in Ontario, and we'll support the Francophone community as we have, along with the rest of the communities. Our province is made up of people around the world, and obviously the Francophone community and has been here from day one, and I'll always support them. They have a large community here in the north, and we're there to support them any way we can, and we're going to continue supporting them. But going back to mental health, again, there's no two governments in the history of this country, the federal government and the provincial government, that have ever put more money into mental health and addiction. I always add addiction, so important, to a tune of $3.8 billion. Those are staggering figures. The province put in $1.9 billion. The federal government matched it. So there's a tremendous amount of funding out there, a tremendous amount of programs, and it's absolutely critical. Even before the pandemic, it's critical. And we're the first government in Ontario ever to have a Minister of Mental Health and Addiction. So we take this very seriously, and we'll always support the people that need our help. And it was a great announcement of $14.5 million here in Sudbury. So there's a lot of programs going around, and Minister Tavola has been doing a great job as our Minister of Mental Health and Addiction.
ਕੈਨੇਡਾ ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਥੈਰੇਸਾ ਨੇ ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੀ ਆਊਟਬ੍ਰੇਕਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਮਾਮਲੇ 1,32,924 ਨੇ ਅਤੇ ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਕਾਰਨ 9,163 ਮੌਤਾਂ ਹੋ ਚੁੱਕੀਆਂ ਨੇ। 88% ਲੋਕ ਇਸ ਅਲਾਮਤ ਤੋਂ ਨਿਜਾਤ ਵੀ ਪਾ ਚੁੱਕੇ ਨੇ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਹਰ ਰੋਜ਼ 47,000 ਤੋਂ ਜ਼ਿਆਦਾ ਲੋਕਾਂ ਦੇ ਟੈਸਟ ਕੀਤੇ ਜਾ ਰਹੇ ਨੇ।
Today, I'd like to talk about the importance of our built environment to healthy living and healthy communities, especially during the pandemic. But first, I'll begin with the usual updates. There have been 134,924 cases of COVID-19 in Canada, including 9,163 deaths. 88% of people have now recovered. Over the past week, 47,806 people were tested daily, with 1.1% of people testing positive. An average of 618 new cases have been reported daily during the most recent 7 days. Our built environment, being the physical spaces where we live, work, study and play, have a significant role on our health. These environments, if designed with public health in mind, can benefit our mental health, our access to exercise, nutrition and healthcare, and our exposure to infectious diseases and hazardous materials. Changing our physical environment is a powerful way to improve health. For example, over the last century, improving sanitation, infrastructure planning, and addressing residential overcrowding reduced infectious disease rates in Canada. I was pleased when the Government of Canada recently announced the Canada Healthy Communities Initiative to help governments and community partners advance the goal of healthier living environments during the COVID-19 pandemic. This initiative could support local projects to adapt public spaces to enable people to more easily follow public health measures, while encouraging and providing opportunities for them to be more physically active and improve their mental health. Over the summer, we saw many examples of municipalities adapting public spaces in ways that encourage outdoor social and physical activities. Many communities closed selected streets to traffic to allow pedestrians and cyclists to exercise outdoors safely. Restaurants, bars and cafes set up or expanded outdoor seating so that their customers could dine safely at least 2 meters apart. And I expect we will see more innovations this fall that will help us live healthier and be socially together while physically apart. But still, the most important reminder when out in any public space is to keep up our public health practices of physical distancing, frequent hand washing, and wearing a mask when physical distancing is not possible.
ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਨੇ ਦੱਸਿਆ ਹੈ ਕਿ ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਕੈਨੇਡਾ ਦੇ ਸਭ ਤੋਂ ਵੱਡੇ ਸ਼ਹਿਰ ਵਿੱਚ ਕੋਵਿਡ-19 ਦਾ ਪ੍ਰਕੋਪ ਘਟਾਉਣ ਦੇ ਲਈ ਫੰਡਿੰਗ ਕਰਨ ਦੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਗਈ ਹੈ। ਟੋਰੀ ਨੇ ਐਲਾਨ ਟੋਰਾਂਟੋ ਸਿਟੀ ਹਾਲ ਦੇ ਵਿੱਚ ਇੱਕ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਨੂੰ ਸੰਬੋਧਨ ਕਰਦਿਆਂ ਕੀਤਾ। ਇਸ ਦੌਰਾਨ ਟੋਰਾਂਟੋ ਦੇ ਸਿਹਤ ਵਿਭਾਗ ਦੇ ਅਧਿਕਾਰੀ ਆਈਲੈਂਡ ਡਿਵੇਲਾ ਅਤੇ ਫੈਡਰਲ ਸਿਹਤ ਮੰਤਰੀ ਪੈਟੀ ਹਸਦੂ ਵੀ ਮੌਜੂਦ ਰਹੇ।
Minister, first of all, may I say thank you, and may I say on behalf of the people of the City of Toronto, and we'll hear as well from Dr. Davila and Councillor Cressy, that this is an announcement from our federal government that is welcome and it is necessary. Because I think we've seen very clearly, and it's been thanks to the transparency that has been aided and assisted by Dr. Davila and her team, that COVID-19 can impact anyone in this city. And it has shown not too many signs of slowing down. We're seeing a bit of a resurgence that we have to attend to, and how we handle the spread even going forward will really help us to measure and achieve greater progress. And a big part of our efforts in reducing the spread is through our focus on proper self-isolation. We know that there are many homes in the City of Toronto, not just in densely populated areas, but in multi-generational families and so on, where self-isolating, as the Minister said, is something that is very difficult to achieve, if not impossible, and that is going to contribute to the spread of the virus. Data has shown us that lower income neighbourhoods were disproportionately affected in the early stages and today by COVID-19, in part because individuals living in these communities, once they tested positive, may then have experienced difficulty in being able to properly isolate themselves. And so that is why discussions began some time ago. And I want to acknowledge here today some of the very early discussions, as Dr. Davila and the Minister would know, were with the Deputy Prime Minister, Chrystia Freeland, who has also extended her support to this initiative, which has been successfully deployed in other cities and other parts of the world. And I think it's just another example of evidence that the city, working in partnership as we have done with the Government of Canada and with the Government of Ontario, is doing everything that it can to make sure that we stop the spread of this virus. So I want to thank the federal government and Minister Hadju for today's announcement. I want to thank the Deputy Prime Minister for her assistance in this all the way along, as well as the members of Parliament from the City of Toronto. And I want to thank Dr. Davila and Joe Cressy, Councillor Joe Cressy, for their leadership here at Toronto in going through the complex task of actually making this happen and putting the agreements in place. And finally, I want to say thank you in advance to the people who will use this. we've emphasized the fact that it's voluntary, and not everybody would, even when they're ill and even when they want to care for their loved ones, would volunteer to move away from home for a period of time and live somewhere else. But I think there are going to be a lot of people who will use it because they are considerate of their own family and of their neighbors and of their fellow citizens, and I want to say thank you to them for their cooperation. We've seen a lot of that. I was on the subway this morning and saw, literally, I was looking hard to see if I could find somebody who was not wearing a face covering, and I couldn't. And I know there probably was somebody on the train somewhere, but I just think the kind of compliance we're seeing with these things is very heartening.
ਫੈਡਰਲ ਸਿਹਤ ਮੰਤਰੀ ਪੈਟੀ ਹਸਦੂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਕੈਨੇਡਾ ਸਰਕਾਰ ਕੈਨੇਡਾ ਵਾਸੀਆਂ ਦੀ ਭਲਾਈ ਲਈ ਵਚਨਬੱਧ ਹੈ ਅਤੇ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਦੌਰਾਨ ਸਭ ਨੇ ਮਿਲ ਕੇ ਕੰਮ ਕੀਤਾ ਹੈ। ਕੈਨੇਡਾ ਵਾਸੀਆਂ ਦੀ ਸਿਹਤ ਨੂੰ ਲੈ ਕੇ ਸਰਕਾਰ ਨੇ ਬੇहद ਗੰਭੀਰਤਾ ਨਾਲ ਵੀ ਕੰਮ ਕੀਤਾ।
Today, obviously here to make an announcement with the City of Toronto. You know, as the Mayor mentioned, that we've been working at the federal level with partners all across the country, at the provincial, the territorial, and indeed at the local level. And the goal has been one goal, which is to keep Canadians safe no matter where they live. And I think it's this Team Canada approach that's been noticed actually around the world, that despite any partisan differences that we might have, you know, of course there's many different kinds of perspectives across the country on many different issues. One thing has been true in Canada for COVID-19, that we've all really put our shoulders to the grindstone and worked together, put aside differences that we might have politically with one solid goal in mind, and that's to protect the health and safety of Canadians. And in fact, Canadians have joined us in that effort and have made tremendous sacrifices over the last several months, personal sacrifices, too many to name, but of course you've all heard the themes, whether it's employment, whether it's sacrifices around seeing family, personal sacrifices around work and others. We know that Canadians have been working really, really hard to contain the virus and slow the spread of the virus in Canada, but we can't let our guard down. And as people gradually return to workplaces, as we see schools open, we do expect to see resurgences in cases, and it's important that as we learn to live with COVID-19, that we don't let those resurgences get out of control, and that we do everything in our power to reduce infection and spread across our communities, because that's what's going to protect our families and our communities at large. And that's why we've been focused on encouraging everyone to continue with the public health measures that hopefully by now are familiar to all of us, to wash our hands, to reduce our gathering sizes, to stay in our bubbles, to make sure that we are doing everything possible, even when it's hard, to reduce spread, including staying home when we're sick, and that if we do get sick with COVID-19, that we stay apart from others. Really critically important. And we know that that's not easy for everyone. We know that depending on people's situations, they may be living in congregate settings with roommates in crowded housing conditions. Financial costs can make it impossible or unsafe to effectively self-isolate. And when this happens, of course, this increases the risk of spreading COVID-19 to other people within the household. In fact, we've seen this worldwide, that one of the greatest risks is the spread within household members. And that's why today we're confirming $13.9 million in funding for Toronto Public Health to operate a voluntary self-isolation centre. Now, together, we can reduce the spread of this virus in Canada's most densely populated city. The 140 rooms of the voluntary isolation centre will provide a safe place for people who have been diagnosed with COVID-19 and don't have an ability to self-isolate. Think about people that have to share bedrooms or share washrooms or share kitchen facilities. It can be incredibly challenging to stay separate from household members when you're sick with COVID-19. And we've heard heartbreaking stories of people knowing that they are ill and knowing that they don't have the capacity to stop the spread within their own home.
RCMP ने साबका लिबरल MP राज गरेवाल ਨੂੰ ਵਿਸ਼ਵਾਸ ਤੋੜਨ ਦੇ 4 ਮਾਮਲਿਆਂ ਤੇ $5,000 ਤੋਂ ਵੱਧ ਦੇ ਫਰਾਡ ਦੇ ਮਾਮਲੇ ਵਿੱਚ ਚਾਰਜ ਕੀਤਾ ਹੈ। RCMP ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਇਹ ਚਾਰਜਸ ਸਤੰਬਰ 2017 ਵਿੱਚ ਸ਼ੁਰੂ ਹੋਈ ਮੁਜਰਮਾਨਾ ਜਾਂਚ ਦਾ ਹੀ ਨਤੀਜਾ ਨੇ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ ਉਸ ਸਮੇਂ RCMP ਨੂੰ गरेवाल ਦੇ MP ਰਹਿੰਦਿਆਂ ਕਥਿਤ ਤੌਰ ਤੇ ਸ਼ੱਕੀ ਲੈਣ ਦੇਣ ਕਰਨ ਦੇ ਮਾਮਲੇ ਵਿੱਚ ਅਲਰਟ ਕੀਤਾ ਗਿਆ ਸੀ। ਇੱਕ ਨਿਊਜ਼ ਰਿਲੀਜ਼ ਵਿੱਚ RCMP ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਉਸ ਸਮੇਂ ਦੋਸ਼ ਲਾਇਆ ਗਿਆ ਸੀ ਕਿ गरेवाल ਵੱਲੋਂ ਕਈ ਮਿਲੀਅਨ ਡਾਲਰ ਦਾ ਨਿੱਜੀ ਲੋਨ ਲਿਆ ਗਿਆ ਸੀ, ਪਰ ਉਹ ਇਸ ਦੀ ਰਸੀਦ ਐਥਿਕਸ ਕਮਿਸ਼ਨਰ ਨੂੰ ਵਿਖਾਉਣ ਵਿੱਚ असफल रहे सन। अजे हालात उन्हां ते ब्रीच ऑफ ट्रस्ट का दोष लाया गया सी। यह भी आख्या गया है कि गरेवाल वालों ये लोन अपने निजी फायदे लिए अपने पब्लिक ऑफिस की वरतों करदियां होया लए गए। इस तो इलावा ये दोष भी लाए गए सन कि उन्हां सरकार वालों दिते हल्का ऑफिस संबंधी फंडां नूं भी अपने निजी फायदे लई वरतिया। पंजाब ਦੇ ਜਲੰਧਰ ਸ਼ਹਿਰ ਦੇ ਜੰਪਲ ਰੋਟੇਰੀਅਨ ਓਂਕਾਰ ਸਿੰਘ ਫਲੋਰਾ ਸਰੀ ਨਿਊਟਨ ਰੋਟਰੀ ਕਲੱਬ ਦੇ ਸਾਲ 2021 ਲਈ ਵੀ 11ਵੇਂ ਪ੍ਰਧਾਨ ਚੁਣੇ ਗਏ ਨੇ। ਓਂਕਾਰ ਸਿੰਘ ਸਰੀ ਵਿੱਚ ਪਿਛਲੇ ਲੰਮੇ ਸਮੇਂ ਤੋਂ ਫਰਨੀਚਰ ਦਾ ਬਿਜ਼ਨਸ ਕਰਦੇ ਆ ਰਹੇ ਨੇ। ਓਂਕਾਰ ਫਰਨੀਚਰ ਇੰਪੋਰਟਸ ਲਿਮਿਟਡ ਦੇ CEO ਨੇ। ਰੋਟਰੀ ਕਲੱਬ ਦੇ ਨਾਲ ਉਹ 5 ਸਾਲ ਪਹਿਲਾਂ ਜੁੜੇ ਸਨ ਅਤੇ ਨਿਊਟਨ ਰੋਟਰੀ ਕਲੱਬ ਵੱਲੋਂ ਸਮਾਜ ਸੇਵਾ ਤੇ ਲੋਕ ਭਲਾਈ ਦੇ ਕਾਰਜਾਂ ਵਿੱਚ ਮੋਹਰੀ ਭੂਮਿਕਾ ਨਿਭਾਉਂਦੇ ਆ ਰਹੇ ਨੇ। ਟੋਰਾਂਟੋ ਉਹਨਾਂ ਲੋਕਾਂ ਲਈ ਕੋਵਿਡ-19 ਸੈਂਟਰ ਖੋਲ੍ਹਣ ਜਾ ਰਿਹਾ ਹੈ ਜਿਹੜੇ ਖੁਦ ਨੂੰ ਸੈਲਫ ਆਈਸੋਲੇਟ ਨਹੀਂ ਕਰ ਸਕਦੇ। ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਇਸ ਸੈਂਟਰ ਦੇ ਲਈ $13.9 ਮਿਲੀਅਨ ਮੁਹੱਈਆ ਕਰਵਾਏ ਜਾ ਰਹੇ ਨੇ। ਇਸ ਦੇ ਨਾਲ 12 ਮਹੀਨਿਆਂ ਦਾ ਖਰਚਾ ਕਵਰ ਹੋ ਜਾਵੇਗਾ। ਟੋਰਾਂਟੋ ਦੇ ਮੈਡੀਕਲ ਅਫਸਰ ਆਫ ਹੈਲਥ ਡਾਕਟਰ ਐਲਨ ਡਿਵੇਲਾ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਇਹ ਸੈਂਟਰ ਇੱਕ ਹੋਟਲ ਦੇ ਅੰਦਰ ਹੈ ਤੇ ਇਸ ਲਈ 140 ਕਮਰੇ ਰੱਖੇ ਗਏ ਨੇ। ਇਸ ਨੂੰ ਵੀਕਐਂਡ ਤੇ ਖੋਲ੍ਹਿਆ ਜਾਵੇਗਾ। ਉਹਨਾਂ ਸਾਈਟ ਦੀ ਲੋਕੇਸ਼ਨ ਬਾਰੇ ਵੀ ਚਾਨਣਾ ਨਹੀਂ ਪਾਇਆ ਤੇ ਇਸ ਫੈਸਿਲਿਟੀ ਤੇ ਲੋਕਾਂ ਨੂੰ ਰੋਜ਼ਾਨਾ ਖਾਣਾ, ਬੈੱਡ, ਸਾਫ਼ ਸੁਥਰਾ ਮਾਹੌਲ ਅਤੇ ਹੋਰ ਮਿਲੇਗਾ। ਇਸ ਦੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਉਹਨਾਂ ਦਾ ਟੋਰਾਂਟੋ ਪਬਲਿਕ ਹੈਲਥ ਸਟਾਫ ਵੱਲੋਂ ਫੋਨ ਤੇ ਨਿਯਮਿਤ ਤੌਰ ਤੇ ਧਿਆਨ ਵੀ ਰੱਖਿਆ ਜਾਵੇਗਾ। ਡਾਕਟਰ ਡੀਵਿਲਾ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਸੈਂਟਰ ਦੀ ਵਰਤੋਂ ਕੌਣ ਕਰੇਗਾ ਇਸ ਦਾ ਫੈਸਲਾ ਟੋਰਾਂਟੋ ਪਬਲਿਕ ਹੈਲਥ ਕਰੇਗਾ। ਬੋਰਡ ਆਫ ਹੈਲਥ ਦੇ ਚੇਅਰ ਜੋ ਕ੍ਰੈਸੀ ਨੇ ਬਿਆਨ ਵਿੱਚ ਕਿਹਾ ਹੈ ਕਿ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਦੀ ਸ਼ੁਰੂਆਤ ਵਿੱਚ ਡਾਕਟਰਾਂ ਤੇ ਪਬਲਿਕ ਹੈਲਥ ਮਾਹਿਰਾਂ ਨੇ ਕਿਹਾ ਸੀ ਕਿ ਜੇ ਕੋਈ ਵਿਅਕਤੀ ਕੋਵਿਡ-19 ਪੋਜ਼ਿਟਿਵ ਪਾਇਆ ਜਾਂਦਾ ਹੈ ਤਾਂ ਉਹਨਾਂ ਨੂੰ ਆਪਣੇ ਘਰ ਵਿੱਚ ਸੈਲਫ ਆਈਸੋਲੇਟ ਹੋਣਾ ਚਾਹੀਦਾ ਹੈ। ਉਹ ਵੀ ਵੱਖਰੇ ਬੈਡਰੂਮ ਅਤੇ ਬਾਥਰੂਮ ਦੇ ਨਾਲ ਆਪਣੇ ਘਰਦਿਆਂ ਤੋਂ ਪਾਸੇ ਹੋ ਕੇ ਰਹਿਣਾ ਚਾਹੀਦਾ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਟੋਰਾਂਟੋ ਦੇ ਬਹੁਤੇ ਘਰਾਂ ਦੇ ਵਿੱਚ ਇਹ ਸਾਰੀਆਂ ਸਹੂਲਤਾਂ ਨਹੀਂ। ਜਦੋਂ ਪਰਿਵਾਰਕ ਮੈਂਬਰਾਂ ਤੋਂ ਦੂਰ ਖੁਦ ਨੂੰ ਸੈਲਫ ਆਈਸੋਲੇਟ ਨਹੀਂ ਕੀਤਾ ਜਾ ਸਕਦਾ ਤਾਂ ਘਰ ਵਿੱਚ ਕੋਵਿਡ-19 ਫੈਲਣ ਦਾ ਡਰ ਵੱਧ ਜਾਂਦਾ ਹੈ। ਕੈਨੇਡਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਪੈਟੀ ਹਾਜ਼ੂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਜੇ ਕਿਸੇ ਹੋਰ ਸਿਟੀ ਨੂੰ ਇਸ ਤਰ੍ਹਾਂ ਦੀ ਸਾਈਟ ਦੀ ਲੋੜ ਹੈ ਤਾਂ ਫੈਡਰਲ ਸਰਕਾਰ ਉਹਨਾਂ ਦੀ ਮਦਦ ਕਰਨ ਲਈ ਵੀ ਤਿਆਰ ਹੈ। ਕਮਿਊਨਿਟੀ ਟ੍ਰਾਂਸਮਿਸ਼ਨ ਨੂੰ ਰੋਕਣ ਦੇ ਲਈ ਇਸ ਤਰ੍ਹਾਂ ਦੀਆਂ ਸਾਈਟਸ ਦੀ ਵਰਤੋਂ ਪਹਿਲਾਂ ਨਿਊਯਾਰਕ, ਸ਼ਿਕਾਗੋ, ਵੁਹਾਨ ਅਤੇ ਚੀਨ ਵਿੱਚ ਹੋ ਚੁੱਕੀਆਂ ਨੇ। ਸਾਬਕਾ ਕੈਬਨਿਟ ਮੰਤਰੀ ਅਤੇ ਐਮਐਲਏ ਜਿੰਨੀ ਸਿੰਮਸ ਨੂੰ BC NDP ਵੱਲੋਂ ਸਰੀ ਪੈਨੋਰਾਮਾ ਹਲਕੇ ਤੋਂ ਮੁੜ ਉਮੀਦਵਾਰ ਨਾਮਜ਼ਦ ਕੀਤਾ ਗਿਆ ਹੈ। ਪੰਜਾਬੀਆਂ ਦੀ ਭਰਵੀਂ ਵਸੋਂ ਵਾਲੇ ਇਸ ਹਲਕੇ ਤੋਂ ਆਪਣੀ ਮੁੜ ਨਾਮਜ਼ਦਗੀ ਦਾ ਐਲਾਨ ਹੋਣ ਤੋਂ ਪਿੱਛੋਂ ਜਿੰਨੀ ਸਿੰਮਸ ਨੇ ਹਲਕੇ ਦੇ ਵੋਟਰਾਂ ਵੱਲੋਂ ਮਿਲਦੇ ਆ ਰਹੇ ਸਹਿਯੋਗ ਦੇ ਲਈ ਉਹਨਾਂ ਦਾ ਧੰਨਵਾਦ ਕੀਤਾ ਅਤੇ ਆਗਾਮੀ ਚੋਣਾਂ ਵਿੱਚ ਭਰਵੇਂ ਸਮਰਥਨ ਦੀ ਅਪੀਲ ਵੀ ਕੀਤੀ। ਜ਼ਿਕਰਯੋਗ ਹੈ ਕਿ NDP ਦੀ ਘੱਟ ਗਿਣਤੀ ਸਰਕਾਰ ਵੱਲੋਂ ਸਮੇਂ ਤੋਂ ਪਹਿਲਾਂ ਚੋਣਾਂ ਕਰਵਾਉਣ ਦੀਆਂ ਕਨਸੋਆਂ ਨੇ। ਸਰੀ ਪੈਨੋਰਾਮਾ ਵੱਲੋਂ ਪਿਛਲੀ ਵਾਰ ਲਿਬਰਲ MP ਸੁਖ ਧਾਲੀਵਾਲ ਦਾ ਥਾਪੜਾ ਹਾਸਲ ਲਿਬਰਲ ਉਮੀਦਵਾਰ ਪਨੀਤ ਸੰਦਰ ਨੂੰ ਜਿੰਨੀ ਸਿੰਮਸ ਨੇ ਹਰਾ ਕੇ ਇਹ ਸੀਟ ਜਿੱਤੀ ਸੀ। ਸੂਤਰਾਂ ਦੇ ਮੁਤਾਬਕ ਇਸ ਵਾਰ ਲਿਬਰਲ ਪਾਰਟੀ ਵੱਲੋਂ ਪਨੀਤ ਸੰਦਰ ਦੀ ਥਾਂ ਤੇ ਸਾਬਕਾ ਮੰਤਰੀ ਡਾਕਟਰ ਗੁਲਜ਼ਾਰ ਸਿੰਘ ਚੀਮਾ ਨੂੰ ਮਜ਼ਬੂਤ ਉਮੀਦਵਾਰ ਵਜੋਂ ਉਤਾਰੇ ਜਾਣ ਦੀ ਸੰਭਾਵਨਾ ਹੈ। ਯਾਦ ਰਹੇ ਕਿ ਸਰੀ ਪੈਨੋਰਾਮਾ ਉਹ ਮਹੱਤਵਪੂਰਨ ਹਲਕਾ ਹੈ ਜਿਸ ਨੂੰ ਲਿਬਰਲ ਪਾਰਟੀ ਦਾ ਗੜ੍ਹ ਮੰਨਿਆ ਜਾਂਦਾ ਹੈ ਪਰ ਪਿਛਲੀ ਵਾਰ ਇਹ ਸੀਟ NDP ਦੇ ਖਾਤੇ ਵਿੱਚ ਚਲੇ ਜਾਣ ਕਰਕੇ ਕ੍ਰਿਸਟੀ ਕਲਾਰਕ ਦੀ ਅਗਵਾਈ ਵਾਲੀ ਲਿਬਰਲ ਸਰਕਾਰ ਲੁੜ ਕੇ ਗਈ ਸੀ। ਅੱਜ ਦੀ ਨਾਰਥ ਅਮਰੀਕਾ ਨਿਊਜ਼ ਵਿੱਚ ਬਸ ਇੰਨਾ ਹੀ। ਹੁਣ ਤੁਸੀਂ ਮੈਨੂੰ ਮਨਦੀਪ ਕੌਰ ਖਾਲਸਾ ਨੂੰ ਦਿਓ ਆਗਿਆ। ਧੰਨਵਾਦ ਜੀ।